kind of switching gears to the congregate shelter, what do you think will have to be different about the shelters, now that we're in the time of COVID? So it's not the before times. What do you think we'll have to do differently to make everything run smoothly?
I think, it's going to take a lot to go over, systems with volunteers. People are going to have to keep their social distance. They're going to have to keep that 6 feet. They're going to need to keep their masks on. Now, know that you're going to open before people are going to get that 3rd shot.
Mm-hmm.
I do believe that most people, you have a really good vaccine coverage rate with your participants, and you will have 100% vaccine coverage rate with your volunteers. So the risk is really low of any problems, but we really want no problems. So keep your mask on when you're on site for volunteers. Keep your mask on for participants as well. Keep the 6 feet. I would have somebody at an entrance making sure that everybody either uses sanitizer or washes their hands immediately upon entering. And the food line, people should not be serving their own food. People can certainly walk through 6 feet apart and have the food served to them, but having people share utensils. The tables, I think people do need to be 6 feet apart, again, because they're taking their masks off to eat. Spacing of mats, people have to be head to foot. So one mat, at the top is the head, the next one at the top is the feet, so that you can have people maybe closer than 6 feet, but they have 6 feet in length.
Mm-hmm. Yeah.
And having an ample supply of masks available for participants who may not have access to wash their masks as the rest of us do, or to change them out, especially if they're working and not coming into the Hope Center.
Yeah, then I know that's been one critical thing that we've encountered over the course of the pandemic, is making sure that we have easy access to masks. Seems to be something that's real critical, because a number of people have come in without masks into the agency initially, and when we asked them, where's your mask, and they said, well, I just didn't have an opportunity to get one. But once you offer it to them, they're more than happy to wear it. And I've appreciated the flexibility of everybody that we've served that's come in to follow these procedures. We actually haven't had much issues with people being resistant to any of the requests that we've made, especially for masking. So, and I know that some other agencies have. I'm not sure why we've been successful in that realm.
It's trust. You've earned it. You follow up and you follow through with your participants, and that is really what has done a world of good in this pandemic for the people you serve.
Yeah. Well, and it's a privilege, I think, to serve people even during these times. And so, yeah, I mean, if you don't have the trust, then you're really not going to get anywhere, because you're talking to people about their personal healthcare decisions, and if there's not trust there, you can't even have the conversation. So we're really hoping that we'll be able to continue to increase the coverage of vaccinations. I'd love to reach 100%. That's probably not realistic, because there's always, I think, going to be certain people who just, for whatever reason, just decline. Do you think at any point that like the federal government, like HUD, will change their policy to require vaccinations? And I'm just asking I'm not taking a position either way. I'm just curious as to whether you think HUD will say something like you have to be vaccinated to access shelter at some point.
I would hope not.
Yeah.
I would really hope not. It is the stance of certainly of many organizations that people have, a right to shelter. And, we have a significant history of racism in medicine in this country, and a significant lack of trust that we've built up in certain populations. And that does need to be addressed and honored. And through this process of talking about vaccines, it's really just become more apparent as to how that trauma has really impacted people's view of healthcare, and trust. So we need to really work to have conversations with people that are meaningful, and to address their concerns, and to follow up, follow through, do what you're going to say, be where you're going to be, to really start to break down those barriers to care, and to earn trust, and earn the right to be able to give that person a vaccine.
That's well said. That's yeah. I mean, that's we do have a long legacy in this country of not treating persons of color well in a lot of different ways, and that's I think important to keep in our mind, and that it's you know it's a highly personal decision, and yeah, I'm so grateful that we've had this partnership with Heartland and with you and all the other people through Heartland that have participated and helped keep our clients safe. Are there any other things that you want to mention right now before we close about COVID or vaccinations or anything related to it?
So, be mindful of symptoms. Everybody should also be doing, I guess one thing I didn't mention is everybody should also be doing a symptom screen on admission to shelter, making sure that people are asymptomatic, reminding people that they do have access to rapid testing at the Hope Center and hopefully even broader access.
Mm-hmm.
And that we intend on standing at Heartland as a healthcare provider for persons experiencing homelessness in your area. We really do intend to stand with you and by you through opening up your congregate shelter spaces again. We're going to be there. We're going to be there every step of the way to make sure that your participants, your staff, and your volunteers are comfortable and remain healthy.
Well, we definitely appreciate it, and thanks so much for spending time with us talking.
It's my pleasure. Thank you so much for asking, and have a great day.